Great. Okay, well, thank you all for joining us for this webinar. I want to introduce our panelists. First, we have Sharon Wise, a clinical social worker and therapist at Wired to Bloom Therapy with more than 25 years of experience. And we have Megan Lobsinger, a professional therapist and owner of Threaded Wellness. She specializes in pregnancy and postpartum wellness. And Michelle Flaum, professional clinical counselor and professor at Xavier University. She wrote a book on managing the psychological impact of medical trauma and developed the first university certificate in medical trauma-informed care, and also has a new book coming in 2026 on treating medical trauma. So welcome, everybody.
Hi, thank you.
I'm going to
Thank
jump right
you.
into our questions. Sharon, can you talk about what are some of the common emotional responses people experience after a miscarriage and why it's important to acknowledge those feelings?
Yes, thanks for having me. Excited to be here. Um, I think they're pretty similar to typical grief, grief and sadness, obviously, shock and numbness, especially in the beginning. Sometimes it's, people struggle to get to the sadness and grief because they kind of stay stuck in shock and numbness and just trying to process what just happened, especially if it was kind of a shock. Um, Guilt is, kind of replaying the entire pregnancy. What could I have done differently? Did I do something wrong? You can see people kind of get stuck in that for, you know, months, sometimes years later. I wish I would have done whatever. Anger, anger at our bodies, anger at ourselves. Did I do too much? Why did my body fail me? Partners, medical professionals, and just the unfairness in general of the situation, kind of like, why me? Um, and a big one that we can see is isolation or loneliness, and it's not always talked about. Just I hear often, well, if somebody didn't have that shared experience, I find it hard to talk to them about what I'm going through. It doesn't look like the grief of a parent or grandparent or friend. It feels very specific, and that can lead to some isolation and loneliness for sure. It's important to acknowledge the feelings because when we verbalize our feelings, that becomes validation for those, which kind of can start and support the process of healing. It can reduce the isolation and shame if we are, especially if we're sharing those feelings with other people. That kind of then opens up that avenue for people in our lives being able to support us. Um, it protects our mental health because what we know about feelings, if we don't get them out, and we internalize those, then that can lead to a whole host of other, problems, emotional, mental health, medical problems even. So, and it just honors the significance of the experience. So, yeah.
I appreciate that response. There's a quote that I like a lot that talks about grieving and how you're grieving, what might have been. And, that is kind of a special kind of grief.
Absolutely. And that is for forever, really. I mean, like that as that child would have, gotten older and aged and milestones and, high school graduation and, all of those things are, so that it is, it's grieving what could have been or what we kind of think was supposed to be, right? Like this was what was supposed to be. So yeah.
Michelle, could you talk about how many people struggle to reach out for help and misconceptions about therapy or counseling after a miscarriage?
Absolutely. And thanks for having me, Megan. I would say one of the biggest, and this goes beyond pregnancy loss, is that there's this perceived stigma about reaching out and getting help. That somehow, if we reach out for counseling, that says that we're weak or that we're not able to, handle things on our own. And unfortunately, that keeps some people from reaching out and getting help. I think sometimes too, if we think of miscarriage as kind of a disenfranchised kind of loss in a sense. Sometimes we don't get the support and the validation of our friends and our family after a pregnancy loss, especially if we have a hard time talking about the experience and talking about our grief and talking about our loss. There can be this sense of feeling like everyone is expecting us just to move on and to not be struggling. And I think the other piece that I've seen with some of my clients is this idea that I can't go to counseling or therapy unless I've experienced a critical event like a trauma that goes beyond our kind of what we would normalize as traumas like pregnancy loss. So sometimes my clients will say, well, it's not like I was in combat. It's not like I, got into a horrible car accident. So, in some ways kind of invalidating their own experience. And so coming to counseling and talking about that and recognizing that this can be extremely traumatic for for someone to endure. And I think the other piece that I see sometimes is clients worrying that coming to counseling will require that they move past this to the point where they need to forget about the baby, or that, and somehow that it feels like kind of a double loss in a sense, that they're not ready to grieve maybe, but also that fear of will I be asked to to move past this to the point where I need to forget. And rightly so. I mean, people often, I mean, they don't want to forget. That's they want to learn how to to in some ways live with this experience and live with this loss, but in a way that doesn't isn't detrimental to their lives moving forward. And so I think when we can dispel some of those myths or misconceptions about therapy, that it's really about meeting you where you are, and honoring your process. And grief looks different for everybody, and as counselors we recognize that and we really honor that in working with each one of our clients.
Oh, yeah, thank you. That seems so important because I know I read a lot about and experience, the stigma around pregnancy loss, and then there's the stigma around therapy, and it seems like, just a lot of barriers to people getting the help that they might want and need.
Absolutely, yeah.
Megan, can you tell us, in your experience, what does the healing process look like for somebody after a miscarriage? Are there certain milestones or turning points?
Yeah, I also want to say thank you. I'm so delighted to be part of such an important conversation. Um, I really think that so much of the work of healing is done just by validating the experience of a birthing person who's experienced loss. As a culture, we don't do a very good job setting support people up to know how to offer support after loss. There's no process. We don't expect people to grieve. We don't really have a context for that kind of grief. And so people are often wondering, just to echo what Michelle and Sharon have said, if what they're feeling is normal, if other people feel this way. And that is so reinforced by the pressure that we put on pregnant people to not share about their experience, sort of to prevent the community from the discomfort of having to acknowledge loss. Um, So really, I think just having a space where all the feelings that Sharon mentioned are validated and, made normal is a big part of the healing process. Um, and also processing that guilt that Sharon talked about. I think like we sort of try to make sense of the grief and find some meaning in it by feeling guilty and feeling like we've failed. And so to work through those feelings of guilt and failure and come to a place of acceptance about our experience, I think is really important. That's a big turning point. And then I would say, if it is going to be part of a birthing person's life to experience pregnancy in the future, just getting prepared for those next steps and the fact that you will never again have an anxiety-free pregnancy. Carrying around your loss is going to be part of your experiences in the future.
And I think it's important also to recognize that your medical care team might not realize that as well. So, even in my experience, I had recurrent miscarriage. And even on my third time going in being pregnant, the doctor was just, "Oh, this is so great. Let me tell you where your due date is. And this is when your baby's coming." And I'm like, let's just slow our roll, see if anything's happening, and, like, see if we can see anything on the ultrasound, and then we can talk about, the future. So even at a practice that I'd been to for years at that point, there wasn't recognition of, my experience, or, the anxiety or the reality really at that point for me. So I think, I love the points that you guys are bringing up because they ring so true and, lived experience. So thank you guys.
Yeah, I think it's just acknowledging the loss, right? That provider being able to say, I see you, I feel you, I hear you, and we will keep that in mind as the pregnancy progresses, and just a large amount of empathy and support and patience.
Yeah. Sharon, can you talk about how loved ones and communities can support individuals and couples and navigating, through this grief or even into the future?
Yeah, I think what I was just saying was kind of a segue into that, just acknowledging, I mean, knowing that that person, may want to isolate and may not want to talk about it, or maybe, ashamed to talk about, or not quite sure how to bring it up, just creating a safe space by acknowledging, like, I'm so sorry what you're going through. Your loss matters. And avoiding things like, at least it happened early, or you can always try again. Those, sometimes what we say has the best intentions, but it can often be um, not received in the way that we intend it to be. Just being present, not having to problem solve, or create or provide a solution. Just sitting, being with the person, whether it be physically or emotionally. A text in the morning, hey, I'm thinking about you today, no need to respond. Even weeks and months down the road, when maybe people have, that has slowed down for the person, like, hey, I'm still here. um, you know I'm still thinking about you. You're still important, um, and it's okay if you don't hear back, right? Some people are just very private and in the way that they grieve, and if that person does begin to open up and share with you, just um, I guess reflecting back what you hear from them. Yeah, I hear what you're saying. I understand how you feel that way. Practical support, I think, is really helpful if there are other children. toddlers or elementary age children that offering to help with them, if you have children their children's age, or bringing by a meal, or um, running errands, laundry, whatever the case may be, just really like offering practical support, like, hey, I can take you to an appointment if you need it. Just being patient. I think society wants us to like hurry, like I want you to be okay, right? You're my friend or my loved one, and I just want you to be okay. And but just being patient. Our healing isn't linear. And just kind of keeping that in mind with whoever it is that we're supporting through it, and encouraging professional support. If they're feeling like, yeah, therapy just doesn't really feel like a good fit for what I'm going through, maybe support groups, or if faith is important to them, someone from their church, or a minister, or whatever feels supportive for them. And just realizing that support can look different too, for depending on the person. People just need different levels of that. And I think one final thing, just avoiding comparisons or unsolicited advice. Like, oh my gosh, I had a friend who had 3 miscarriages. I understand how you feel, or she did, my friend did this, or when do just realize, recognizing that each person's journey and experience is unique. So, yeah.
And I love what you said about not problem solving, because I don't think a lot of people realize that there is a lot about that, especially really early pregnancy, that we just don't know a lot about. So you might have your loss and you'll never know why that happened. So, those kinds of questions or problem solving sort of things can just make you feel even more lost in those feelings of why did this happen? What did I do? Um,
I think people just so badly want to take that away, that pain away, right? And all, most always come from the best of places. But yes, when you're in the you are the person grieving, especially in a pregnancy loss, that doesn't always feel helpful. So just recognizing that each person is unique, and asking what can I do to support you? That's a really simple, easy thing to do, and continuing to ask that question as time goes on. I'm acknowledging this milestone, or, this anniversary date. How can I support you? How can we acknowledge that in a way that feels good for you?
And Michelle, Sharon just sort of talked about this a bit, but can you talk a little bit about how professional counseling might make a difference, or why someone might want to pursue that, instead of or in addition to getting support from their friends and family?
Yeah, absolutely. So, kind of piggybacking off of, some things that Sharon said, most of the people in our lives want us to be okay. They have a big stake in our being okay. And so, you know, uh, sometimes they can engage in behaviors that can be really, really helpful for us. And sometimes they can inadvertently try to rush us through a process. So when I had said before how important it is that we meet people where they are, professional helpers, professional, mental health providers are trained to do just this, to meet people where they are, with support and with kindness. But these are also people who are on the outside looking in, and so their perspective can be very different and very helpful, compared to those who are really close to us in our lives, who might be well-meaning, but because they have a stake in our being okay, um, might engage in minimizing or invalidating, again, not purposefully, but still it can be very painful. And so to go to a professional helper who's able to really, sit with that person and provide the support and the unbiased, non-judging perspective is really powerful and is often needed. That we need our own process to be honored and respected, and sometimes it's really hard for our loved ones to do that. It's hard for them to see us hurting, and so again, as I said before, they may inadvertently say or do things to try to rush us, through that process, and that could end up, really doing some emotional damage.
Definitely. Megan, can you speak to, to some of the unexpected grief or pain that people might experience during miscarriage?
Absolutely. I think that I think sometimes people are surprised by the degree of the physical experience of miscarriage. I don't feel like we're set up very well to know what to expect sometimes. And this is one of those situations where we're walking into medical care that is routine and so treated as routine by medical providers, but experienced as really traumatic. And there's often not a lot of follow-up when we're, moving through that physical process. And Sharon, I'm so glad that you mentioned the practical support.
Mhm.
I think because that physical experience of loss can be just so much more significant than we expect. Getting the community, like the way that communities will wrap you up in support by providing meals and offering to help with childcare, that sort of support does not tend to show up after miscarriage.
Mhm.
So, yeah, I would say definitely the physical experience. I think I'd add that sometimes people feel surprised by how different their experience is from their partner's experience. And I think you both mentioned a little bit the isolation you can feel just inside of your own home as you experience this loss really differently. You as birthing person are going to experience the hormonal change and the loss of the physical experience of going to medical care, going to OB-GYN visits. Like there's so many parts of it that are hard to relate to for a partner. So I think that can be really surprising. And then the other one I really want to mention is just how much anger and frustration you can feel with other pregnant people in your life. Um, often you're experiencing loss and then being asked to go to a baby shower a couple of days later. Like you're in the same phase of life with your peers who are moving through this process. And it's really common to feel super furious at people who are having ease in the area of pregnancy. And that is such an okay feeling to feel and a hard one to express to people.
Yes, definitely. And I think that even goes for just hearing, the day-to-day talk in your office of families and, when you want that so badly and giving yourself the grace to kind of maybe walk away from those conversations if that's what you need to do. So, Sharon, can you talk about how can you help clients kind of manage the balance between processing grief, going back to their normal routines, and then maybe even thinking about those future pregnancies?
Right. I want to just go back to what Megan said and thank you for acknowledging those feelings of being in the same phase of life with people who may be pregnant or or have similar experiences, because that is really difficult to not be angry, and then you carry the guilt of being angry at your friend or your sister or your next door neighbor or whoever that person is in your community, and that can feel really not good, if you're the person having those feelings on top of grief. So having said all that, I think it's just normalizing for people that or for ourselves, like it's okay, it's okay, I'm having these feelings. Self-compassion is huge during this time. I'm going to try and move away from the self-doubt or the self-blame or whatever things I may be feeling into just self-love, and self-support, and I'm going to take extra good care of myself today, or I'm going to allow myself to not go to my next door neighbor shower, and that's okay. And just being honest with your support system, your close people. I can't do it today, whether it be taking the preschooler to school, or doing something big and celebratory. I don't want to go to a birthday party today. So um self-compassion and acknowledging where you are with your close people is really important to be able to do. And just introducing routine is important. Routine is a good road to healing, not all at once, not like, hey, I'll be back at work next week and I'll be there 9 to 5, and pull that extra shift on Saturday morning. Just I think just assessing, just self-assessment. Where am I with this? What do I personally need to start to get back to things? Other children, that we may have help us do that really, really quickly, whether we're not, whether we are ready to or not, especially if they are, of age where they have a lot of needs. And as you transition back to life, creating grief breaks, creating space and time to be able to feel those feelings. I think that's really, really important, especially if we're returning to work, returning to community responsibilities, and returning to, our other children, just not being consumed by that routine again, and just building those breaks in. Um, yeah, and I think more just self-assessment of I don't, maybe I'm not ready. Maybe I am ready. Involving your partner in those discussions. Because you may be on different timelines of considering another pregnancy. Um, coordinating with your medical professionals. Am I physically ready to do this again? If you're seeing a therapist or a support group of some sort, am I emotionally ready? I don't think we realize how difficult that will be to enter that next pregnancy emotionally. But do I feel like I'm ready to tackle that? So yeah, just checking in with yourself, and your circle. Lean on your circle. That can be difficult for some people, who might be more independent, or I can do this. I got this. I don't need, people doting on me. But yeah, just being able to count on people in whatever way that you need them to show up for you. So yeah.
Um, Megan, can you talk about the patterns you've seen in OB-GYN screening practices or the referral processes for therapy?
Yes, I can. Um, I think I worked in-house for a regional OB-GYN practice for about 8 years, and with truly amazing, wonderful, sensitive, kind, caring doctors. And I would say the pattern I see is a pattern of absolute lack, just truly lack of screening, lack of expectation setting, lack of follow-up, really a lot of lack there. I'm sure that people listening could share stories about pretty bad experiences they've had in their OB-GYN practices with that kind of care. In my experience, if someone is referred to support groups or therapy, that's pretty rare. It's kind of the exception rather than the rule. Um, And that was true of when I worked in-house and was a therapist in the practice. Miscarriage was often not something that people considered referring people for. So, yeah, I think a lot of times what you're experiencing in your medical care is not much. And once you have experienced loss, there's rarely a follow-up, rarely a phone call, rarely a check-in to see how you're doing. Um, which I don't know if anyone has anything to add to that, but I would say truly just a lack of support.
I feel like it adds to that isolation piece and that loneliness piece. Like, yeah, you were my provider for through this entire pregnancy, and yeah, I think to not be acknowledged or being reached out to can feel like, oh gosh, everyone's kind of moving on, right?
Mhm.
Like everyone's moving forward, and here I am, and nobody's in that professional capacity checking in on me. So yeah, that can be really, really painful.
Yeah, and Megan, to what you said before about, in subsequent pregnancies, not having anyone acknowledge that you had experienced loss, I think because miscarriage is common and often not a sign of anything medically wrong, it isn't charted as something to bring up in the future. And so, you're not ready for people to be gung-ho about your pregnancy, but on the provider side, it's like, cool, we're here again. Let's go.
Yeah, it is one of the things I've kind of wondered about in terms of, I know when you have a baby, there's kind of that automatic postpartum depression screening, which is wonderful that that's automatic. I think in most practices, but you're not seeing something or anything that's screening people who have a loss, even though there are still those, I think someone mentioned it, like the hormonal changes and some things that you might be experiencing during the loss as well. So I hope that that can move, forward and become a little more standard.
I've done hospital work before, and you open a patient's chart and you have an alert or just a note at the top about allergies, right? Or something that is really important to know about, a do not resuscitate order, whatever those things are. I I've not done OB-GYN work, but gosh, it would be nice if there was just the minute you open that, like this person has suffered a pregnancy loss in the past, yeah, just as a reminder at every appointment.
Right. Yeah, of the anxiety that they're probably carrying.
Yeah,
So
absolutely.
yes, through my whole successful, pregnancy, and the whole time I was just holding my breath, like
Yeah.
waiting for what's going to go wrong, and it kind of carried through the entire thing, even when I'm literally laboring with that baby. I'm asking them to please monitor its heart rate, nonstop the entire time until the baby was out, was I not convinced that I was going to lose this baby. So, I mean, yeah, you definitely carry that into any subsequent pregnancy. Um, Michelle, maybe you could talk about some of the signs that show you might be beginning to heal emotionally, or kind of maybe what you've seen about the power of counseling and helping somebody as they, move forward.
Absolutely. So, I think Sharon and Megan have both talked a lot about these, very holistic effects of this loss and even this trauma, that's not just affecting our bodies. It's affecting us emotionally. It's affecting us spiritually. It's touching every area of our lives. And so, I think when we begin to see the signs that someone's beginning to heal, we can see those signs quite holistically as well. So those signs can be anything from, I'm starting to sleep better. I'm eating more regularly. I have a little bit of energy to exercise, to noticing that the the kind of intensity of my grief is starting to decrease. So I'm not crying as much every day, or I've gotten through a couple of days and I didn't cry at all. Or I'm just thinking of things that I've seen in my clients over the years, but also things like being able to experience a fuller range of emotion. A client came in once, and after she had experienced miscarriage, and I'd worked with her for a couple of months, and she came in one day and she sat on the couch and she said, "I laughed today.
Mhm.
I haven't done that in 2 months." Or I smiled, I experienced the spark of joy, or I I felt like myself today for the first time, or I found myself thinking about the future. I found myself kind of interested in engaging in maybe a hobby that, hadn't even crossed, that person's mind. Or one client said, I decided to go back to church. She was someone who attended regularly, and this happened, and she really began to question so much in her life, including her belief in God, and asking those big questions. Why me? Why did this happen? Um, and so these are, just a few of the signs. Certainly, the ability to talk about the loss. I mean, sometimes with this kind of grief and this kind of trauma, we really struggle to put words to our experience. We don't want to talk about the loss, and so signs that something starting to open up is that we have more of a willingness to talk about it, to talk about the experience, to talk about the loss. Sometimes it's reconnection with our partner, or family members, because maybe we've isolated for quite a while. So noticing that we feel more connected to the people around us. And I would say another piece of this is really looking at our relationship with ourselves, noticing that maybe we're being a little kinder to ourselves. We're able to experience a little more self-compassion, less maybe self-blame if we've been engaging in that kind of at least kind of thinking that somehow we were at fault for what happened. So I think these are just a few examples of those signs that we're moving through the healing process. And with any kind of grief, that's really what we're looking for. It's not necessarily that we're looking for, you need to hit this milestone at this time, because everybody's different. The focus is there movement? Are you moving through a process at whatever pace feels, okay for you? But is there movement? And so those are just a few of the signs that I notice.
Yeah, I love what you said about, the pace, like the pace that you're
Mhm.
comfortable with. Sharon, what's one thing you wish every person who's experienced miscarriage knew about recovery and emotional well-being? We've had, a lot of great discussion so far, but is there anything that we haven't talked about?
Yeah, I feel like we have been trained or feel like grief is something that we get over. Like I'm gonna get once I get over it. So grief isn't something we move from, we move on from, we move on with. We take our grief with us. We don't move away from it. Will those feelings be less intense over time? Will those soften over time? Absolutely. But it is a part, it becomes a part of you and your story and who you are and how you show up for other people. So it and to piggyback on what Michelle said, there isn't a schedule. There isn't a time frame in which somebody recovers from something like from and you may have friends, you may have great friends or a sister who went through it, and I think it's easy to say, well, gosh, they didn't do it that way, or why is it taking me so long? Because it is, and it's okay. It's okay. The self-compassion again, the permission, it's something that you will carry with you for the rest of your life, and that's okay. Yeah, yeah. I think that's the only thing that I would add that I haven't heard.
Yeah. Megan, can you talk about, for somebody who's hesitant to start counseling, maybe due to some of the things we've talked about, like the stigma or just a fear, what would you say to them?
Yeah, I think, you know, it never hurts to give it a try, of course, and to step into that vulnerable space and just see how it feels. I think a lot of the hurdle is just getting a sense for what it feels like when you enter that counseling space. You don't have to go back. You can just try it out and be done with it. But I think I'd also say it's really invaluable to have a person who, like Michelle said, doesn't have a really strong stake in quickly making you feel better.
Mhm.
To be able to say to you, take your time. It's okay for you to feel this for as long as you need to. Just like everyone else has said, this is your pace and I'm here for you. And anything you want to express, anything you want to say, I can listen to that and I can do so with no judgment.
Yeah, thank you. And I'll just say, for part of for the Miscarriage Support Dayton nonprofit, part of what I'm trying to do is curate a list of counselors who specialize or have a passion for helping people who are going through miscarriage. So if anybody who's listening to this now or in the future wants to pass a name on, you can find the contact on the website, and we can kind of build that list together. So I think that can make it more accessible to families, to kind of know who actually might want to help me, and who knows what I'm going through, or who can, who has a passion for helping people through this. Michelle, if you could, for people listening today or listening to this recording in the future, is there a small step they might start with, just to start healing?
Yeah, I would say first and foremost is to carve out a little bit of space and a little bit of time to sit and really check in with yourself. How am I doing? How do I feel? What do I need? It's that self-compassion that really needs to be at the center of healing. And that's hard work. Self-compassion is really hard work. Um, but it can start with just taking a few moments, checking in with yourself. And, if you determine that, yeah, I need some help, I'm really struggling, then to consider, all that we've talked about during this last hour. Hopefully, something we've said has maybe reduced a little bit of anxiety about reaching out and getting some support, getting help, whether from a professional helper or someone in your life. That really what's I think most important is that you meet yourself where you are, because likely you're surrounded by people who maybe have a hard time seeing you where you are, that may be painful for them to see you hurting, and so sometimes we can speed up our own process when we're not ready. And so kind of coming back and really checking in with yourself, I think, is that small step, but it's critical to know where to go next.
Definitely. And I just want to ask everybody who's listening, if anybody has another question they want to hear from our panelists about, you can put it in the Q&A. Um, I just want to circle back to a question we got in advance, which I think Megan could speak to about the Karen Kleiman's art holding grief and loss, in terms of expectations and how those expectations were suddenly unrealized.
Yeah, I think so much of what we've already talked about is echoed in her work, but she really deals with the particular weight of motherhood, and holding space for the sort of really profound truth that this experience is not your fault. I think as pregnant people, we're really set up by our care to think like, well, if I'm just really in control of what I eat
Mhm.
and how much I weigh and the level of activity I'm doing, like there's just this sort of illusion of control that feeds so deeply into the guilt. So Karen Kleiman's work is very much about what it's like as a mother to
Mhm.
carry that weight and responsibility and how to hold space for people going through that particular kind of weight and just acknowledging like all the pressure that's put on the mother to carry that experience forward.
Thank you. And this is also something we've talked about before, but it did come in as a specific question. So if anybody has any additional thoughts, just about addressing like the fear and the trauma of the loss when you're going through a subsequent birth, is that something that might be like an additional reason you might want to seek counseling, or, is there anything people should know about just dealing with that?
I mean, I would say from, the trauma perspective that it is really important if you feel um, eh, comfortable enough to reach out for professional help. I mean, that can make a real difference in how you experience this, this subsequent pregnancy. This is really, really difficult. And when you've had a trauma like this, there's so much that can come up, when you experience a subsequent pregnancy that can trigger, your stress response. And that certainly can make pregnancy so much more difficult psychologically, physically, and there's real help that you can get for managing the trauma of this.
I don't think that is spoken enough about, that it is a trauma. It is,
Mhm.
and I think, connecting with your OB-GYN, throughout that next pregnancy, advocating for your like, hey, this is where I'm at. Like I'm really, really struggling. Well, I'm having a lot of anxiety through this pregnancy that I'm in, and I need you to know that, and um yeah, just, not isolating those feelings throughout that pregnancy, and they wouldn't understand, or I you know yeah, just identifying that for your medical providers too. Yeah.
Yeah, I would add to that to your for your medical providers and also for your partner. If you're going through pregnancy with a partner, right? Like I'm a huge advocate for couples counseling and at least some couples work to help partners know how to support someone experiencing anxiety in a subsequent pregnancy.
Thank you. Is there anything else anybody wants to kind of add as we wrap up what we've been talking about? Great. I really appreciate you guys joining for this and making time for this. It's such an important topic, and I feel like there was a lot of valuable information. Um, if If anybody wants to, view this again, I'll be posting on the Miscarriage Support Dayton website. You can also find the counselor list there as we build it. Some additional research, that comes out of the research academia side of things, about, just researching what people feel and also information about the grant program we have for people who don't have access to insurance that might cover mental health counseling for people who live in Montgomery County. There's a simple application process for that that you can find on the website as well. So thanks everybody for listening, and thank you so much to our panelists for being here.
Thank you for having us.
Yes, thank you so much.
Absolutely. Thank you.